Hi everyone, my name is Dr. Michael Wald, otherwise known as the Blood Detective, and today we're going to be talking about how sugar causes various diseases in different parts of the body and how to recognize them. I'll also talk about some of the lab tests that you must know if you suspect that you might have a blood sugar problem or you want to make sure that you don't develop a blood sugar problem in the future. I'll even discuss briefly how to interpret these tests. We'll look at the clinical ranges, which are the ranges on a blood test of these various tests. Those are based on average people, but did you know that there's something called optimal ranges, which compares your various types of blood sugar tests to healthy people, and that's what you want to know. So first I'll mention that the information I'm about to impart to you is meant for educational purposes only. It is not meant as a substitute for sound medical or health advice. So listen to these various problems in the body that are affected and or caused by problems with blood sugar management. Sugar in the adult brain is known as Alzheimer's disease. That's not a joke. It's even called diabetes type 3. Blood sugar in your eyes is called glaucoma, or even cataracts. Blood sugar in your mouth, cavities. Blood sugar in your sleep will impair sleep, causing insomnia, even nightmares. Sugar in your blood is obviously called diabetes. Sugar in your skin can be called skin tags. Yes, skin tags that grow on the skin are usually promoted by high blood sugar. Sugar in your overall system could be called cancer. We know that glucose is a major fuel to grow tumors, so we obviously want to mitigate blood sugar imbalances, especially high blood sugar or hyperglycemia, if you want to avoid cancer and or treat cancer most effectively. And sugar addiction is 8 times more powerful than cocaine. And as just an observation, which is maybe a little bit political, but sugar on Wall Street is called a multi-billion-dollar industry. But there's a few more you should know about. Sugar in your kidneys is called chronic renal failure. Sugar in your skin can be called candida or other types of infections which grow from this high glucose level. Sugar in your arteries is atherosclerosis or hardening of the arteries. Sugar in your fingers or toenails is called fungal infections. Sugar in your nervous system, inflammation and plaquing. And last but not least, sugar in your hair is called brittle hair and hair that falls out, basically unhealthy. These are just some of the tissues in the body that are affected by high blood sugar. But sometimes blood sugar issues are not recognized early enough, and that obviously results in various disease states. Many of them can be avoided. So let's talk about some of these tests. There's fasting blood glucose, which should literally be fasting. So you want to schedule an AM test the night before the morning of your tests. You want to eat a dinner and then fast until you're testing. So, try not to schedule your test for midday or late in the day because you want to properly be fasting. And usually people are more compliant if they eat their dinner, then they fast overnight, and then the next morning they have their blood sugar test performed. And then there's hemoglobin A1C, a very important test which reflects about 3 months average of your blood sugar. And then there's something called fasting insulin, which helps detect insulin resistance. If your insulin is not working well, insulin will not effectively take glucose out of the blood and put it in the tissues where it's needed. And there's an oral glucose tolerance test, a very interesting test called C-peptide, which measures insulin production by the pancreas. So it can tell us if your pancreas is weak and if that's where the focus should be to correct your blood sugar problems. And then there's fructosamine, which is similar to hemoglobin A1C. Fructosamine is a 2 to 3 week average of blood sugar, and hemoglobin A1C, as I mentioned, is about a 3-month average. So sometimes clinically, we want a shorter average of blood sugar, so we'll do fructosamine, and if we want a longer average, we'll look at hemoglobin A1C. And then there's an HOMA test and something called advanced glycosylation end products. But what's particularly important is imparting to you some information about how you should be interpreting these tests. So look at this slide for a moment. I've just named some of the tests. There's a clinical range, which you'll see down the middle, and to the right, you'll see an optimal range. So an optimal range are based on studies of healthy people and where your blood sugar values should be. And the clinical ranges are based on seemingly well people that are considered average people. So if you look at the fasting glucose for the clinical range, for average individuals, it's 65 to 99. But there's less disease from blood sugar problems if you keep your blood sugar between 75 and 86. So anything above an 86 is considered abnormal by functional practitioners like myself. I should also mention that I published a 500-page textbook entitled The Encyclopedia of Anti-Aging Tests, which I teach doctors how to properly interpret lab tests by comparing people to average people, that's the clinical ranges, and the optimal ranges. I'm going to give you one more example. Hemoglobin A1C. We know that 4.8 to 5.6 is considered normal, and anything above that is abnormal. But from a healthy perspective, we want to be between 4.8 and 5.2. So 5.3, for example, would be abnormal comparing you to very healthy people, but would fall right in the range of the clinical ranges. Now, why are there these differences in ranges? Well, I think the answer is simple. The medical profession and their mental orientations are based on detecting and treating disease. So the laboratory tests are determined based upon when they show disease. That's important, but I would like to know when the dis-ease part of blood sugar issues or disease happens. So in other words, we're healthy, then there's a dis-ease stage, and then there's finally disease, which is where the clinical ranges come in. But obviously, preventing a problem is better than treating it once it arrives. So we want to pay attention to these optimal ranges. Often my patients will tell me, my doctor said all my lab tests are abnormal, I still have all these problems. I compare them to the optimal ranges, they have abnormalities, you treat them nutritionally and naturally, and they do fantastic. So maybe you want to copy this chart and look at my other podcasts. One of them is entitled How to Read Your Own Blood Work, which I review many examples of clinical versus the optimal healthy ranges. And here's just a short list of some supplements to consider. You know, depending on the entirety of your health and your blood sugar issues, you might require very different nutrients than these. And obviously, we want to have you on a blood balancing food plan, which also needs to be based on the entirety of your health history. Having said that, we know that chromium, for example, does enhance insulin sensitivity and helps to promote glucose from entering cells, therefore less in the blood, and that's what we want. Alpha lipoic acid. It improves insulin sensitivity, but it's particularly good for helping to mitigate and treat the nerve damage from glucose, which is called neuropathy, like diabetic neuropathy. And then there's magnesium, which is crucial for insulin signaling and glucose inflammation. And you can obviously see that you might need to take a combination of these to get all of the effects that you need. And then you use the lab test to make sure that everything's working. You can't just rely on feeling better. And then there's berberine, which activates something called AMPK, which is similar to the diabetic medication metformin. And berberine helps to improve insulin resistance and lowers glucose production or gluconeogenesis in the liver. And last but not least, there's cinnamon, which improves insulin sensitivity. And I've said that a few of these improve insulin sensitivity, but they do it in different ways, and many of them are complementary ways. So once again, this is just a short list of some of the tests to consider. And in addition to that, I always work on a food plan for a client based on their chemistries, based on whatever medications they're on, their exercise plan, their sleep hygiene, their stress, all of that. And then when we talk about these nutritional supplements, the doses need to be adjusted based on what is the proper dose that you need to create the positive changes we see on the testing, and also improvement in overall sense of well-being. So thank you so much for attending this presentation. I hope it was useful for you. Please let me know about your comments and continue to send these topics to me. You sent the request for this one and I did it. So thank you so much and have a great day.